have a note on their file to allow myself 45 minutes to perform the procedure, because sometimes it can take that long. And I'll just put that in perspective. Although I allocate half an hour as standard for any patient that attends to have their earwax removed, just in case there's any complications and it takes longer. The average earwax removal, I would say, is probably 4 or 5 minutes, give or take, per ear. So about 10 minutes, I would say. Quite often it could be a lot quicker as well. But with this particular patient, I need that additional time. And a lot of it is because, and you'll notice it in this ear more than the right, I'm having to continuously go in and out of the ear, and that's because the suction probe keeps getting blocked, because I'm having to use the fine end. If I use the big suction probe, which I am trying to do here at the moment, you can see the ear canal collapses. I just can't get in. So as I try my best to enter, the canal gets vacuumed up by the suction probe. So again, I'm having to revert to the fine end. I think, actually, before I do that, I turn down the suction power slightly on the suction machine, so just to see if I can get in with the big sucker. And I did up to this point, but thereafter I had to revert back to the fine end. And I'm just, you can see I'm moving it side to side. As I am, I'm trying to come away. So the reason why I'm rocking it side to side is though the skin is still attached, the debris is attached to the ear canal wall. So by rocking it side by side, I'm detaching it from the sides of the ear canal. I've just gone back to the fine end. And you can just see how much more moist and damp this is. And it continuously blocks the probe. So on this occasion, factoring in the time I was in and out the ear, because when I show you the video back, I edit all the moments where I'm not in the ear. I don't edit anything else. Everything else is exactly what we do. It comes up to about 17.5 minutes, the procedure, but when you factor in all the time not spent in the ear, it was just under half an hour actually, so I did pretty well. You will see at the end there was a bit of debris left, but we had to leave that, unfortunately, for two reasons. It wasn't going to affect the patient, but they also began, as I said earlier, they began to experience vertigo, which can happen when you perform earwax removal, and I'll explain why that is. There is a couple of reasons why. When you've got an occlusion like this, when you've got such a severe blockage, it will create positive pressure in the space behind the wax in the eardrum. That can push the eardrum inwards. And two things can happen actually. It will, one way or the other, change the air pressure behind the eardrum in the middle ear. But in some cases, it can increase the pressure, because if the eardrum is being pushed in, the volume of the middle ear is reduced. So therefore, the air pressure is increased. Conversely, sometimes when the eardrum is pushed in, it can stimulate the eustachian tube, the muscles can contract, and it can sometimes cause a negative pressure. So air can escape forced out of the eustachian tube. So the muscles have got an involuntary contraction at certain air pressures. So by increasing the pressure of the middle ear to a certain amount, the muscles of the eustachian tube can contract, cause the eustachian tube to open, and air is forced out through the eustachian tube. So it can create negative pressure in the middle ear. And when you adjust the pressure in that manner, it can sometimes stimulate the organ of balance. It's more likely to